Hi, Mary. Good evening.
Good evening, Dr. Sophocles.
Welcome, welcome, and welcome viewers to another episode of Gynecollege. I'm Dr. Maria Sophocles, the medical director of Women's Healthcare of Princeton, and you're watching an episode devoted to talking about a novel treatment using a vaginal laser called Mona Lisa Touch. Um, the Women's Healthcare of Princeton is very well known for this, but a lot of our viewers are just kind of learning about it. So, with me tonight is one of my very favorite local experts on the topic, Mary Michaels. And Mary's going to tell you why she's an expert. She's going to share her story,
Yeah.
and I'm very grateful because it's a rather private one. And I was very impressed that she had the I guess courage really to say, yeah, I'll talk about something private to me
Okay.
in the hopes that there'll be women out there who can identify, learn, and maybe seek help for themselves. We know that women are not good at talking with each other and with their doctors about sexual issues in particular and GYN issues in a bigger sense. And this is a problem that makes a lot of women sort of suffer in silence, really, for a long time. The other issue is that doctors in general aren't well trained in in talking about sexual issues. There's a lot of kind of gender and cultural distaste for it, I guess. One study showed that between 80 and 90% of doctors don't ever ask women about their sexual health or if they're
Mm.
having issues, including vaginal dryness or painful intercourse. And so, with that, I want to thank Mary again for coming and being a guest on the show and ask if you'll share with our listeners what was going on in your life when you kind of said, I need to get help.
Yeah. Well, Dr. Sophocles, it was just a kind of progression of, having gone through menopause and then starting to feel like, golly, I feel like I'm itching all the time, and it just feeling just kind of really tight and then getting really dry, and it just was getting so uncomfortable. And it didn't seem to be diagnosed by my doctor. It didn't seem to be my GP. It didn't seem to be anything that the skin doctor had anything to really add to say, what it might be. And it just got to be really unbearable in terms of just the dryness and the uncomfortableness and the itchiness. And I finally said, there's got to be something. And I looked online, and I saw this thing regarding Mona Lisa Touch and was like, well, that's kind of interesting. And, maybe I need to do it, and I need to do it for myself because I just was so uncomfortable. And that's where I came across you and your site and learning about the Mona Lisa Touch treatment. So that's kind of how I ended up in your office.
Right, right. And when you came, I remember, we talked about several different things. I asked
Yes.
you about bladder issues and having urgency or frequency or just an inability to have comfortable voiding or things like that. And you said,
Yeah, and,
yeah,
and you know, putting together a longer history is that I've had really an extended history of UTIs ever since I was, very young, and they've kind of occurred throughout my adult life. And so I then, interstitial cystitis. I'd never heard of that. What was that? I mean, I thought all the what seemed to be UTIs turned out to be interstitial cystitis, that it wasn't actually an active infection. It was just the irritation, the sense of urgency, the needing to go
mhm,
a lot, but it wasn't truly an infection. And so that was in there. And
right. And
you,
that's important because many women will have sort of non-specific irritation of the bladder, and they either just get treated for urinary tract infections over and over and over, when instead it's really interstitial cystitis, an inflammation of the bladder interstitium, the bladder wall. This is poorly understood. It's not easy to treat. And we don't know if it's completely related to a lack of estrogen from menopause, but we do see that a lot of women have a worsening of this after their menopausal. So it has led to a more broad understanding of the fact that when women go through menopause and the estrogen levels in their body drop, it's not just hot flashes that happen. It's a chronic, progressive sort of deterioration of the whole genitourinary system. And there is a medical term for this now, GSM, or genitourinary syndrome of menopause. It refers to atrophy of all the genital tissues. That includes the bladder, the urethra, the vagina, and the vulva. So, of course, a common finding is sex becomes more uncomfortable
Mm.
because there's a lack of moisture. But that's often just part of a bigger picture. And so many women will come to my office saying, I can't explain exactly what's going on. My doctor just keeps treating me for urinary tract infections,
Mm.
but my bladder just either isn't working right, or it's irritated feeling, or I pee and then it feels like I have to go again.
Mhm.
Um, Other women have issues on the outside, the vulva. Tell me what issues you were having there and how
Yeah.
that added to this problem.
Yeah, yeah, yeah. I feel really healthy, but yeah, that was an issue that basically I think impossibly having to some relation with chronic Lyme disease. But I got the basically a lichen sclerosis that you were able to diagnose for me, and that lichen sclerosis was causing the tissues, the labia was starting to just kind of shrink, and the irritation and the itchiness was just it was just I don't want to say unbearable,
Mhm.
but almost. It was just so
Yeah.
much of all of that going on, and you just layer all of these menopausal types of issues, and that I guess was a typical one that was in there as
Mhm.
well.
Right. So lichen sclerosis, just to be clear, lichen sclerosis, it sounds worse than it is, I suppose, because it sounds like multiple sclerosis.
Yeah.
Lichen actually comes from the word for wood, and it's because the tissue of the vulva actually becomes woody. It becomes thickened, but it's not stronger, it's weaker.
Mm.
And the tissue is damaged, it's diseased, it is a chronic condition, so it's forever, like asthma or diabetes. I suppose not like asthma, maybe like diabetes, and it's very poorly diagnosed. So many women think it's just aging, part of
Mhm.
aging, but it's in fact a separate skin condition, much like eczema. And it is treatable, very easily treatable with steroid cream or with the laser. The
Mhm.
laser will normalize the tissue. It will replace the diseased tissue with normal tissue, or some normal tissue. So lichen sclerosis is not necessarily related to menopause, but if you
Mm.
have lichen sclerosis and then you become postmenopausal, the tissue becomes less healthy on top of it. Like you said, like a layering of problems, right?
Right, right, and I guess the other, again, I guess postmenopausal thing in terms of the breast cancer, and I don't feel I'm a huge breast cancer survivor at all, but I did have DCIS stage 0, so yeah, that was in there too, and that was part of the reason why looking at a treatment that would be able to use something like the Mona Lisa Touch, it that I could.
hmm Because there's no medication, there's no hormones, there's no non hormonal medication, there's no medication at all. So the Mona Lisa treatment uses light and in the form of a laser. A laser is a very specific type of light energy. It was actually partially sort of invented by Albert Einstein. He won a Nobel Prize for his contributions to the creation of laser. And then in 1964, a British gentleman, Charles Townsend, invented the laser itself. And then he won the Nobel Prize then for that. So laser has been used in medicine since the 1960s in all kinds of medicine. I trained in the 1990s and we used laser inside the abdominal cavity. But it wasn't until 2008 that two physicians in Milan, Italy, figured out how to use a laser just with specific settings that would affect the vulva and the vagina. The settings are very specific, and they're very, very gentle and very, very safe. And that's really important. I get asked all the time, well, can it injure other parts of my body? One woman said, I'm picturing Star Wars and the
Oh,
lightsabers. And
goodness, no.
it's really right, not like that at all. It's a very refined pulses of light. They go just 200 microns deep, so superficially that they frankly can't injure anything else, but deep enough that they cause a tissue healing response.
Mhm.
So when we put the little probe in the vagina, we fire the laser, we paint the vaginal surface and
Yep,
the vulvar
right.
surface with these little
Mhm,
dots.
mhm.
And I want you to tell everyone what it feels like when that happens.
Sure.
What do you feel?
The very first time, because the vagina was so dry and so uncomfortable, I did feel when you put the probe in the first time. I mean, it wasn't painful, but definitely noticed. But the actual treatment is just really pretty easy. I mean, you put I want to say a numbing type of solution on the exterior, and what you showed me regarding the actual laser, just the number of like little pinpoints. It's
Hmm.
that's as much as it is, and I think even the percentage was very small as to how much would be
Yeah.
affected by it. But
It,
you put it in and you rotate it around, and you don't feel that. And you also, for because of my lichen sclerosis, you will then switch the end of it and put on something else so you can do the exterior of the vulva area as well to treat that. And it doesn't hurt. And if there's anything, it's just kind of just that's a little notice, but it's
right.
nothing big at all.
Yeah.
So
My patients just say, like you, it's sort of underwhelming. You almost think, how can that
yeah,
little do that much? And in fact, only 8% of the surface
right.
receives those little light pulses. But that's enough. That's all you need to trigger a protein creation, a response that then will do two very important things. It will make new blood vessels, and those new blood vessels will help with the bladder, help clear out bacteria to prevent UTIs. They will help on the vulva to normalize the lichen sclerosis tissue, and
Yes,
they will help in the vagina to make moisture with
moisture.
arousal,
Oh,
right? So
oh,
women tell me, I am aroused, I'm attracted to my partner, I am happy, but there just no moisture will happen. And that's because the blood vessels have left town. So the Mona Lisa will create new blood vessels. The other thing it will do is create new collagen. And the collagen is what provides elasticity to all of our tissue.
mm,
That's why when we lose estrogen, we get wrinkles because our collagen breaks down. So when the collagen breaks down vaginally, of course, there's a loss of elasticity, and that is a death knell to comfort. So by making new collagen and new blood vessels, these doctors in Milan figured out a really simple, elegant solution to restoring vaginal health.
I,
And I'm
yeah, I
grateful
was
to them. I'm grateful to them.
absolutely. And I
Yeah,
was so impressed that I looked up, the CO2 laser, that it's been around for a long time. So it
long
was like, oh,
time.
nothing new there. But
No,
for the treatment after, I think it was the first week, I was like, I could feel moisture again. And as a female, when you're growing up and you're like, oh, you got your period and whatever, you're like, oh, when is this going to stop and whatever. But when you don't have moisture down there, it's uncomfortable. And to get
right.
it back was like, wow. Oh, it was such a relief.
Right. And women are living longer, and they're staying sexually active longer, and they want an active lifestyle longer. So even if it's just for bladder health, people want to be able to go to work, play tennis, do whatever, and not have to wear, pads and worry about incontinence. And women want to be able to have an active sex life as part of an active, intimate relationship. So it's really been so nice for women, really of all ages, but particularly postmenopausal women. Um, and I'm glad you had it. Now, can you explain, Mary, how you had 3 treatments to get the tissue better, but then you come each year? Why is that?
Yeah, you had recommended that, come back yearly was the typical thing, and we tried that for the first year, but it seemed like a year for at least my body and the lichen is a bit long. So
Hmm.
I come in 2 or 3 times in the year, and that touch up allows us to stay ahead of the lichen sclerosis, which I'm again very grateful to keep that at bay and
Right,
just make sure
right,
that, moisture, everything else is working okay.
right. So we adjust, I mean, we adjust the settings. There's standard settings for all women. That is sort of a national algorithm that I teach. But then those settings are sometimes adjusted based on the patient's tissue. The frequency of coming, if it's for vaginal dryness, you come 3 times in a 12-week period, and then about once a year. However, women with lichen sclerosis will sometimes need a second or even third treatment
Hmm.
in a year's time, and we adjust that even retrospectively. Sometimes I'll tweak things. I'll say, things just look great. I think you can stretch it out.
Mm.
Or this has really been flaring. You've had flares of this lichen sclerosis. I think perhaps you should come a little closer together. Or we can add, whether it's hormonal therapy or um, steroid therapy for the lichen. Sometimes we'll go into our toolbox of medical therapy and add to the Mona Lisa. And that's very important. It has no interactions with any medications because it's not a medication. So it's a
Right.
wonderful ability to be able to blend with medications, but decrease the dependency and the use of medications, uh, especially for those breast cancer patients who can't, won't, or shouldn't use hormonal therapy. And an estrogen receptor positive breast cancer patient has really been directed by her oncologist not to use any hormonal therapy. So our hands are very tied with patients like that. And there are thousands of women in the
Mm.
United States who are breast cancer survivors, many of them, in their 40s or premenopausal even, and
Mm.
their estrogen receptor positive cancer, part of the treatment is anti-estrogen therapy like aromatase inhibitors. You may have heard of anastrozole or letrozole or tamoxifen.
That's a good.
When
Mhm.
women go on these therapies, even though they are cancer reducing and life extending, and you'll never hear me say anything negative about them, they are destructive to the vagina, and they can be relationship wreckers, that's for sure.
Mm.
So patients will come to me and say, I'm so happy that I conquered the breast cancer, but no one told me that this medication would do this to my sex life or to my vaginal health. And I cannot take hormones. I can't and I won't.
Mm.
So, the Mona Lisa has been a real godsend for those patients, for sure.
Absolutely.
Yeah, yeah. What, Mary, uh, has there been any downside for you?
That's a good
The
question.
the
Um,
payment, maybe the insurance coverage, lack
yeah,
of insurance coverage.
it is very irritating that the insurance does not cover this.
Yeah,
And on the other hand, like I said, even for the very first time I came, it's like I had to get something done because it was just becoming unbearable. And to me, it's worth every single penny to have my health and have my sexual health and be able to do it. So
right.
I'm very disappointed that it's not something covered. And I think as we had chatted
Me
before,
too.
it's like, hey, if this were a guy's issue, they'd be
It'd be
all
covered.
over it. It'd be like no problem. But
Right,
we
right.
but
Play
it's part of the
Viagra with your treatment.
yeah, exactly. But, that's part of the reason that I want to speak out is that I think it's just super important. That's okay. I just
Yeah,
think it's super important that, more word gets out about this and the importance of getting this covered and being able to have women get their lives back in terms of their sexual health.
yeah.
It's just, yeah.
I think advocacy is an important, you know, topic for women, and certainly in the 60s and 70s, and we had Gloria Steinem and bra burning, and that was all super important. And I think we're seeing a second wave that was sort of pushed along by Me Too, with advocating for against abusive
Mm.
non-consensual sex. And I think the next wave of that, in my opinion, will be women advocating for sexual comfort and pleasure, which sounds so obvious, but not at all. I mean, I think for the last 2 millennia, sex has been for procreation or male pleasure. And so I think just the concept of sex for women's pleasure is frankly sort of foreign to most cultures. I mean, look at the genital mutilation in Africa, right?
Oh,
So,
goodness.
I mean, we have a lot we still have to overcome, and we have
Yes.
to dig out of those Middle Ages kind of
Hmm.
level of thinking. And in our own country, certainly there's room for improvement as well. So I think me advocating for women to, what would you say? I say talk to your doctor, talk to your clinicians, talk to your girlfriend, maybe write to your congressman.
Congressman, right. You got to get something in the legislation there too. Get their
Sure.
attention for sure.
Yeah, because I don't see this getting covered unless people are squeaky wheels, unless they
Right.
say this is not cosmetic, this is
And
not
not in the
optional,
least.
this is healthcare. This is
Yes.
healthcare, as much as, my pap smear, my mammogram, my,
Right.
the cast for my broken arm. I mean, this is healing. It's actually healing tissue. So I certainly hope that as a society we'll get to that, and I hope the 60 million menopausal women in the US could find a collective voice or some advocates for them to lead them there. Um, so a patient of ours, could this be aligned to mental wellness? I definitely think that a good sex life is conducive to mental wellness. Actually, that's been
Partner.
studied, Kimberly, and we know that. We know that a good sex life will is linked to lower heart disease, is linked to lower mental illness, greater happiness, and longevity. All of those, which,
Hmm.
I mean, think about the potential, the power of that. And yet it's sort of swept under the rug as the very last thing a doctor would ask about. I think it has to start in medical education. Um,
Yeah.
when I trained in the 90s, I mean, sexuality was like a 30-minute lecture out of 4 years, and it was all like anatomy
Oh,
and then move on. There
oh
was
my.
nothing experiential or patient centered about it. It was
Mm,
incredibly
mm,
old-fashioned.
mm.
So we have to go there, but I think women are reaching out, don't you? I think women are looking for podcasts,
Mhm.
they're looking for information sources. Um, so that's why I mean, that's really behind Gynecollege. That's why we started this, so that we could have some topics. The next one is April the 1st, April Fool's Day, and we're going to be talking about the race disparity in healthcare, but specifically in women's health. And I think that's a super timely topic too. It's long overdue. But with COVID, we're seeing it magnified, sadly, just like we're
Mhm.
seeing depression and isolation effects and, you know, I mean, abuse and some other
Yeah.
rather ugly things. So I think, again, we have to talk about these things or
Yes.
they don't get changed. So, Mary, I can't thank you enough for being willing to share, some of your story and to advocate on behalf of my patients. I thought you were an excellent representative because you believe it. You
I
believe it.
absolutely. Absolutely believe it, and I'm so incredibly grateful to you because I got my life back. I mean, and I got my sex life back too, which is so important to be able to have that wellness that you're talking about as a
Mhm.
whole woman. And it all of the things, all of the caring that you give, all of the treatment and everything that you've been doing to keep me healthy has been just so much appreciated. And I would hope more women would be interested in wanting to know about this type of treatment and not be afraid of it, because it is nothing to be afraid of it. Yeah, you're
No,
right. Laser sounds weird, but it's like, no, it's not a big deal at all. Like I said, it's like sort of like getting a sunburn where the sun don't shine, but it doesn't last. And
right.
it's not a problem.
Right. So let's review that really quickly. People come and they have three treatments, 6 weeks apart,
Mm,
sometimes a fourth, sometimes a fifth. The timing is actually quite fluid. It can be 4 weeks apart, 5 weeks apart, 7 weeks apart. Those each treatment thickens the vaginal epithelium, the lining, by building nice new cells, new blood vessels, new collagen. they build on each other. So when we looked at the original studies done in Italy, one treatment versus two versus three versus four versus five, there is a benefit to building on each other. But I felt that three was an appropriate sort of national standard to set up, and then we individualize it. Then we say come back approximately once a year for a touch up. I picked that term because I thought of dyeing the hair, and I thought a
Mhm.
lot of women understand that. They understand that when you get your hair dyed, the dye doesn't stop working, the dye doesn't fall out. It's that you keep aging, so you make some gray hairs, you make new gray hairs, and then you have to apply new dye. Same thing, you will keep aging, you will need eventually to replace the cells that have been recreated in an atrophic or delicate, unhealthy way with some nice new
Mhm.
fresh cells. So it just makes perfect sense. And I find that once people do it, they are so happy. They're so happy not to be using medication. The
Oh,
mess, the refills, the cost. As one patient told me, she said, "My gosh, I spend money on my hair and my nails and my clothes, and this is for my body and my
yes.
health, my sex life, my quality of life, my
Yes.
uh, me looking forward, not wanting to be a 75-year old woman with bladder issues." So a
Mm-mm.
lot of women are doing this really preventatively, also, so that they're aging more slowly down there, if you will, or well, without the deterioration that we otherwise see, which is quite normal. I think about 40% of all American women after menopause have sexual issues, whether it's discomfort or libido. And that's a lot. That's a lot of women. I mean, 40% of 60 million is a big number,
Yeah.
right? So,
Definitely agree, and I have to say that having the treatments and getting these things in line, and it things go great after that.
well, I'm glad. I'm glad it's worked out for you. It's not perfect. I would say in my practice, about 90% of women have a significant change in what's going on. So not 100, but very few things in medicine are 100%,
Mhm.
sadly. And for um, for a non-invasive, painless, no medication, no risk option, 90% I think is a very good number. And
Yeah.
usually those 10% are women that are either so severe that they're really almost beyond treatment, which is not many, or they're people who have a false expectation. One woman
Mm.
came from and she said, "I want to be like when I was 25." And I said, "I don't know if I can make that happen. In fact, I'm almost sure I can't, you know."
Yeah.
And so you have to have an appropriate expectation. We're restoring health, but we're not going to make you 25. Maybe a plastic surgeon needs to tackle that, but that was over my head. So,
Well,
um,
I'll admit that I'm 63 and I feel like I'm 25 though, so
oh, that's exciting.
it
That is
feels
great.
so much better.
Good, Mary. That's the best compliment you could give me. Wow, that's awesome. Um, so I hope, Mary, you'll check in again too and watch some other episodes of this. People can go on YouTube and they can go to Gynecollege. I think it's gynecolege.princeton, GYN is the URL, or just look on YouTube and search Gynecollege, and you can see other episodes on vaccine hesitancy, on women and heart disease, lots of topics that I think women need to know about. But I felt that this was important, and you were so great tonight at sharing. Is
Oh,
there anything else you want to say? Did I forget to ask anything?
I think you covered everything. It's just do it for yourself. I mean, it's so important to be able to get this part of your life back, and it helps in so many different ways. So thank you so much, Dr. Sophocles. I'm very, very, very grateful.
Yeah. And just a quick one. This is fine after hysterectomy. So you can use this whether you've had a hysterectomy or not, because
Mhm.
this has no effect on the uterus. This has no effect on hormones, on the ovaries, on anything. The bad news, it doesn't do anything else. The good news, it does exactly what it's supposed to
Supposed
do
to do.
very well. So if you have a hysterectomy, you can come. I mean, I wouldn't come within 4 weeks of the hysterectomy, so that the tissue can heal, right, at the back of the vagina. But you can have this after hysterectomy, or even if you've had a bladder suspension or pelvic reconstruction, a mesh, all those kind of surgeries. The only people we don't treat are if the mesh was put in incorrectly and it's into the vagina and it's
Mm.
inappropriate. Those women, I usually will treat them anyway, but I'll treat them not where the mesh is, so they sort of get a partial treatment. But hysterectomy is not a contraindication to this. There really isn't a contraindication. There's almost nobody this won't help. If women have had radiation to the vagina, sometimes the tissue's so bad, so far gone, I
Mm.
will just do it for free. But we often, those are in that 10% where we don't get a great response. But otherwise, pretty much anybody can have it. So before hysterectomy or after, either way. Anyway, I want to let you go, Mary, because I know you have an 8 o'clock date. Um, and if anyone has any other questions, you can reach me at info@princetongyn.com, or go to our website. You'll be able to reach me, princetongyn.com. And I know, Mary, because I know how thoughtful she is and how committed to the practice she is. I'm sure if you had a question for her, she'd let me forward it. Is that right, Mary? Is that okay?
Absolutely.
Okay.
Absolutely.
All
Thank you so
right.
much, Dr. Sophocles, and thank you so much for bringing Mona Lisa Touch to the States and all that your advocacy on it. It's just so important.
Thanks, Mary. It's really been an honor, and it's been a quite a journey, to see the effect and to hear the stories. I wish I had another hour just to share them, but stay tuned. We'll have more. Anyway, take care
Okay.
and good night.
All right.
Thanks.
Thanks. Bye now.
Bye.